Evidence-based is critical. It's absolutely critical, because if we just think that it works, quite frankly, we can be wrong. And what you need to do is that you don't just throw it out there in the world and say, well, let's just do this and see people get better, because there is such a thing as a placebo effect, people thinking they get better and they don't. So what you do is that you have a structured study that compares, for example, stem cells or PRP, compares it to a cortisone shot, compares it to surgery, compares it to saline or a saltwater injection. So when you put these two together and you say, well, what's going to happen and what is the actual thing that is impacting it? Is it just putting something in there with a needle, or meaning the saline injection? Is cortisone better than PRP, or is PRP better than cortisone? Having a structured study that is well done is absolutely critical, because there is so much research out there that is poorly done. And it's important to define the difference between the two. You have to have what is called a prospective randomized trial, meaning that there's no chance to introduce bias, because we're all kind of biased. We want something to work. So it's very easy to get that wrong. So if you have a prospective randomized trial where you're comparing one thing to the other and showing a very clear benefit, that's what's important. And that is what we're starting to see now. And that is why it's getting to be exciting for orthopedic surgeons, because we're seeing that it can help.